My name is Amna Haque, and I'm doing my master's in public health, specializing in global health. I did my public health practicum with the community health department at Aga Khan Health Service in Mombasa in Kenya. And so I specifically worked on a maternal and child health project that was being launched for the second time in the Msambweni district of Coast Province, and it was called Mama na Mtoto, stepping up efforts to safe motherhood and child health in the district. Specifically, I helped document community health worker trainings. I worked with local stakeholders with the Ministry of Health and kind of creating capacity in building this project from the ground up. The work that I was doing in my practicum was specifically capacity building, documenting community health worker practices, liaising with stakeholders such as the Ministry of Health, and kind of creating capacity so that communities can take ownership of their own health in that particular region. The practicum really significantly contributed to my education as it provided kind of a supplement to the things that I was learning in class. So when we talk about global health in resource-limited settings and looking at cost-effective strategies and implementing programs, I really felt like this was really apparent on the ground when I was in Kenya. I learned the importance of cross-cultural learning, especially in public health. And the significance of that was working in a resource-limited setting. You learn a lot of things that you wouldn't otherwise learn in Canada. So working with existing stakeholders, working with a limited amount of resources, and also working with in a region that has a different cultural context of health. And that was really important to understand for me, because the way we view health in Canada might not be the way that they contextualize health in those settings. So it's really important to kind of take that into consideration when you are working in global health settings. I remember my director at the community health department, in every stakeholder meeting, he would always say, "We can't always provide you money or resources, but we can provide you knowledge." I found that lesson very significant, that I will carry with me in my career, in that capacity building really allows people to kind of take ownership of their own health and really be able to work with what they have. So I think the way that we view public health here maybe is from a top-down approach, whereas global health kind of takes this integrative, whole systems approach, or kind of mixing bottom-up and top-down approaches and putting them together. And I found that really important, especially during my practicum, because not only are you building capacity from the top level from the Ministry of Health, but you're also building capacity at the bottom level with building capacity with communities and allowing them to kind of work together to build effective public health programs. I really encourage students to liaise with their professors in getting some feedback about their practicums and their experience. Going to my professors and asking them for advice and for guidance about certain things that I was doing when I was in the field was really helpful for me.